I think we'll look back and say we've actually tortured seniors for a reimbursement model as opposed to what they really needed. What happens if healthcare providers best equipped to care for seniors can no longer afford to participate and they do not participate in Medicare Advantage? Another one, Medicare's AI prior authorization pilot sparks backlash over incentives to deny care. Should an AI copy of you help decide if you live or die? Doctors share top concerns of AI surrogates aiding life or death decisions. But here's kind of a cool idea I had. Maybe I was delirious from the flu. But, there's really concerns about, AI, the Terminator movies. Maybe AI is, 30% chance. A lot of the smartest minds say, there's 30% chance that AI might basically do away with mankind. So again, I think my predictions for last year were overzealous. So I think maybe it's tempering me this year. But I think one of the big things into next year as an example is the big, beautiful bill. The implications of it is going to wash on shore. That's going to be happening this year. I know many hospitals are like, we don't know how to budget for this. So we're just going to carry our budget forward and basically, this is my words, wing it when we're in the midst of the storm. But I see my own family going, I'm not signing up for Medicare Advantage. People that are in the know in healthcare that are now becoming 65 and like, I'm not signing up for Medicare Advantage. Should private equity have a role in healthcare or not? If we're mature adults, it should be part of the conversation. So that'll be interesting.
I had a hospice experience in 2025, and it changed how I looked at hospice and the provision of care. And I was telling somebody recently, we can talk about 2 million hospice admissions of 1.8 million beneficiaries, of whom 1.2 million died. We can talk about these trends and break it out nationally and regionally. But you know what? One of those deaths was my mom, and that makes a difference. And I hold that up. I think we're going to see more and more of these personal stories that are driving why we're doing what we're doing. And this is somewhat unique in hospice to our brand. Does our organization provide the level of care we expect for our own family members to receive?